Welcome, everybody. Thank you so much for joining us this afternoon. We're going to talk about UVM's Larner College of Medicine Master of Public Health program. We've got a lot to get through today, so we're going to dive right in. But before I say that, actually, I just wanted to let everyone know we are recording this session, and please, if you have questions, please put them in the chat throughout the presentation. Vika will keep an eye on those, as will I. We'll make sure to answer any and all of your questions today. So again, thank you for being with us today. We have a lot to get through. We're going to briefly go over introductions. We're going to talk about what is public health and what are some of the really pressing public health issues that we all keep an eye on in the public health industry today, and just then learning about our program through the Larner College of Medicine and the Master of Public Health program. And we'll answer many questions about the program as well for you today. So as I said, good afternoon. My name is Nicole Willier-Fenton. I work in our professional and continuing education department, and I'm so pleased that we have Dr. Jan Carney with us as well. She leads our public health program through the Larner College of Medicine, and as you can see, has a wide variety and a deep experience in public health, and we're so fortunate to have Jan with us and leading our program. And also with us today is Vika Pleshakova. She works in our continuing and professional education as well, and she works so closely with our Master of Public Health students. So you have questions about that process, Vika is the one who'll be answering on the other end. So we're excited to hear from Vika today. So let's just dive in. We always take maybe a 60 or 30,000 foot view, just really kind of ground ourselves in what is public health and what issues really are we keeping a close eye on these days. So Jan, I'll toss that over to you.
Let me quickly start with the definition, but we want to get into some of the examples because public health is so incredibly relevant and exciting today. But one of the best definitions I found is it's the science and art of preventing disease, prolonging life, and
sorry about that, Jan.
Whoops.
There we go.
And promoting physical health and efficiency. That's an old term. Through organized community efforts. So the key things is public health focuses on prevention, prevent disease and illness, and emphasizes populations. So here's an example from the CDC, our national federal public health agency. And you can just see from this, coronavirus is still front and center, but look at the other kinds of things. We have new news from the FDA about vaccinating very young children, working in the heat-related stress and illness, getting ill from food, and monkeypox. And what's that all about, and how worried do we have to be about that? The environment. Public health deals with the environment, and the biggest single environmental issue is a huge global one. It's climate change. And if you look at this as a chart from the CDC, the whole long and wide range of potential health issues from changes in our climate, and you can just see those. And the best that we can do in public health is to work collectively to try and prevent them. War, a public health crisis. We may not first and foremost think about war as a public health issue, but it is. And the war in Ukraine, if you think about that, what happens to people? They're dislocated from their homes, they become refugees, they don't have access to health care or medications, and they don't have all the social connections and supports of their family. They don't have places to live, adequate food and water. This has been 100 days of war, so this is something that we have to keep in our consciousness of what are the ways that public health can help. And we have colleagues across the country in similar programs to ours, consulting. There's healthcare professionals who are volunteering in countries like Poland, but this is an incredible and current crisis. Gun violence, one of our most controversial public health issues today. And we know there's been an epidemic of mass shootings, and the conversations about how do we prevent these in the same analogous way we prevent other public health issues, such as motor vehicle crashes. We have to change the environment. We have to change individuals' behavior. But importantly, we have to be able to have the conversation, which is something that's really challenging right now.
Yeah.
Healthcare. What is public health's interest in healthcare? It's getting people into healthcare to ensure that people have access to primary preventative care to prevent disease and illness. In the United States, unfortunately, we don't do as well as our peer countries around the world in making sure that every single person has some access to healthcare, health insurance, transportation. This has been something that's been particularly evident during the pandemic, but really has deep roots in our country. And these are social and economic factors that drive health outcomes. In more recent years, and again, during the pandemic, this was unfortunately very prominent. But if you look at the different kinds of factors, whether or not people have enough food to eat, if they have a house, if they have a job, if they have community and social supports, if they have access to healthcare system, all of these things influence health. And unfortunately, our country, we also have to add a long history of racism and discrimination to that list, things that we must address in order for people to achieve their optimal health. And this is the global perspective. Health is in the Sustainable Development Goals. What is global health? It's the principles of public health on a global scale. We live in a global society, so this perspective is absolutely critical to our students and our graduates. And finally, science is evidence, not opinion. And we know there's tons of opinions out there. So one of the communication challenges for us is how do we get that scientific information out there so people can improve their own health and the health of their families, their friends, and the communities.
Thank you, Jan. And I want to touch on a student story and a student perspective that we'll hear in just a minute here. And I really think it's an important piece that you were talking about is racism as a public health issue and a public health crisis. One of our students that you'll hear from was an undergrad at University of Vermont and then decided to embark on the Accelerated Master Public Health Program, which is where undergrad students can begin to take some courses towards their master's degree coming into that junior or senior year, or in between junior and senior year. And one thing that we'll hear from him is he was really looking for ways to gain experience. And I'm so pleased that he reached out and joined the Burlington Board of Public Health. And in that really took on trying to work on systematic racism here in the Vermont area and the Burlington area. And so making an impact in his community where he was learning as well and living is what is public health, right? And so it's so wonderful to see a student making those initiatives and making a difference in their community while he's still learning. So let's just stay with us. We're not going to go anywhere, but I'm going to play this video so we can hear the perspective of Ian.
My name's Ian. I'm a graduate of the Master's in Public Health program at UVM. I came to UVM first for undergrad. I chose UVM because of how awesome the environment was with being so close to the lake and being so close to the mountains and the community environment as well. So I ended up doing the Accelerated Masters of Public Health program at UVM. I ended up studying biology and community and international development, and I was a clinical research coordinator at the University of Vermont Medical Center for pediatrics. While as a clinical research coordinator, I ended up managing a clinical trial for a polio vaccine, and that was like one of the clinical trials I worked on that was like the most public health focused. I think that my background in volunteering pushed me into looking for other public health volunteering opportunities, because at the time I was within public health, but I wasn't in public health. So I ended up finding the Burlington Board of Health, which is a volunteer appointed position by the city council and the mayor. That was my first ever public health, real world experience of being able to work with other people in public health. I think I really learned how to navigate public health in a professional setting, and being able to understand how do we talk about public health, how do we discuss issues, how do we move forward on topics. One of the biggest things that I worked on with another one of my colleagues on the board was really focusing on eradicating systemic racism, because racism is a public health emergency. And how do we as board members, how do we educate ourselves on this and being able to eradicate systemic racism and identify how we are perpetuating it to then stop perpetuating systemic racism. Throughout the program, you learn the basics of public health, epidemiology, how to prevent disease, as well as being able to investigate diseases. And then biostats, like learning how to do all the math, as well as behavioral public health. So you learn how to be able to change behaviors in like positive ways for public health. While I was still in the program, I was applying to a ton of public health jobs. I think after a few years and different life changes, I was ready to move on into like a career in public health. So then I started looking for jobs in New York City and ended up getting a job as a COVID-19 data analyst for New York City Department of Health. I'm really happy I did the program. I think that it really set me up on this new journey within public health in the future.
I think it's important to hear that story from our students as well. And one thing I just want to make sure, and I know we're going to dive deeper into this, is it was just a wonderful thing that Ian was here and on campus and started his accelerated Master's of Public Health, but you do not need to be here because it is an online program. So Jan, will you just guide us through some more of the components of the program for prospective students?
Absolutely. And this is an online interdisciplinary program. It's 42 graduate credits, and we are nationally accredited through the Council on Education for Public Health, and that is the requirement for that. And you can see we have core courses and for different numbers of credits, and you do get some electives. We'll talk about those in just a minute. And then you have a capstone project that really teaches you kind of the team science. How do you actually do a project in a group? And then you get some time to do an applied practice experience. So you get a taste of what are the real world opportunities out there. You can see from the diagram that the traditional core areas are in part of them are in math, biostatistics, and epidemiology. Epidemiology is the language of public health, and is really the most practical and versatile science, in my opinion, that we offer. Social and behavioral sciences, health policy and management, or we also call that health services administration, that link to healthcare, and environmental health sciences. But you can see that there's also many cross-cutting areas, and that continues to evolve as the issues that we have to deal with also change.
Yeah, thank you, Jan.
Our program we have many experts. Our faculty are really wonderful. They're expert in their areas, both academically and in practice, and they also love our students and they love to teach. And these fall into three general categories, but not limited to that: health policy, leadership, and advocacy. Some of the things that we face now, we have to really advocate for those to change because they're not going to change on their own. Global and environmental health, we mentioned that, and the quantitative public health sciences that are really foundational to almost everything that we do in public health.
Great. Now I think we're going to toss over Vika. You work so closely with our students from the inquiry. If maybe some folks on the line with us today might be reaching out and asking some questions to all the way through their graduation, and then we'll talk in a little bit about support as alumni too. But you see students in guiding them in their interest areas too. So maybe share with us some of these electives and how students, you help them to really carve out the right curriculum for them too.
Sure. So we try to offer a wide breadth of the elective courses, and all falling into the three major competency areas that Dr. Carney mentioned before. And all of these courses are taught by the experts in their fields. And as the field of public health changes every day, we try to offer new courses on a regular basis. For example, the last course you see here is Public Health Toxicology. It's a brand new course that we're offering this fall, taught by a state of Vermont toxicologist. So the students will be able to get the firsthand experience in this course and have real life situations applied in this class. And we try to offer at least one of those courses, one of the electives in each excellence areas once a semester. So you will see at least 3 or 4 electives scheduled per semester. And the students can choose one of the areas. As you need to take 3 electives within the program, you can choose 3 courses in one of those areas, or you can dabble here and there and take all of them if you'd like.
Cool. Really neat opportunity to diversify or focus in. And then let's talk about some of the things that you do very closely with our students, as well as Deb Poulin, who also is the career coach too. Walk us through some of these benefits of our program.
Sure. So we offer personalized advising and career coaching to all of our students, as well as inquiries. So I meet with a lot of prospective students, answer their questions, help them learn more about the program before they make the decision and apply for M.P.H. And as the students apply and get accepted, we meet again, we come up with a plan, make sure that you graduate on time and however long you would like to take in the program, because it's very flexible. You can finish the program within 15 months, or you can take the full 5 years, which is the limit for M.P.H. And so based on your life, work, family balance, we will come up with a plan, decide how many courses you would like to take per semester, and come up with a personalized plan based on your interest and availability. All of the appointments are done online or over the phone, as this is an online program, and all of the instructors and advisors and the career coach meet with students virtually. And Career Coach is offering help to our students not only when they exit the program, helping them with their resume, cover letter, but we try to introduce our new students to our network of M.P.H. alums early on. And one of the orientation assignments for you will be to create a LinkedIn profile so you can start creating your electronic portfolio early on and connect to our network of alums out there.
And that doesn't stop when you are an alum as well. You can come back and utilize our services as you want to continue or navigate or change your direction in public health, which is really amazing. So speaking of that, some different career opportunities in public health. This is not a complete list. There's many more. I think Jan could probably come up with a few more, and both of you could. But maybe these are some of the, I think, more common areas that you talked to students, Vika, about their maybe interest in pursuing.
Correct. And the public health is such a multidisciplinary field that you can pretty much work in any area of your interest once you get your degree. And we do keep track of our students. And once you're admitted in the program, you will be able to tap into that database of our students and where they're working currently through our LinkedIn public health student group. And so whether it's the specific field you're interested in, or you're interested in being in a specific geographical area, we would be able to help you connect with some of the alums who are working in that field or specific city or state.
Yeah, absolutely. So we have another quick video. Wanted to share a perspective of the ASPPH, the Association of Public Health Schools. And Tracy Seward runs development and works very closely with students in public health. And so I wanted to share the perspective. She talks about the diversity of roles and career opportunities, that public health is just an incredibly exciting field to be in, as Dr. Carney shared with us a few minutes ago too. So let's just listen to this quick video with Tracy Seward from the ASPPH.
I think the challenge now for a lot of people in public health or students that are interested in public health, but maybe not pandemic seeming related careers, is that reminder that public health is way more than just the pandemic. But either way, it's really great to have this attention, because public health is often an invisible career, right? It's the kind that you don't notice unless something goes wrong. So, when public health is working well, people are healthy, living longer lives, like everything is smooth sailing. So it's just in that absence that you go, wait, there's public health out there helping to keep us all safe. So yeah, there's a huge increase. We've had a huge increase in applications over the past year. There's a lot of interest in the government. There's been a large funding that's come towards public health just the realization that we need different infrastructure and we need to prepare for an aging workforce and gaps in that sense. So yeah, it's kind of an exciting time to be in public health.
I think, Jan, you would second that as well. So let's talk about getting into public health in terms of gaining that Master of Public Health through the University of Vermont. Vika, can you pick us back up here?
Sure. The application process is fairly simple, and this is what we're asking from the students. A bachelor's degree, of course, and one science and math or statistics course. And the reason we're asking for a math or statistics course is that because you will be taking highly quantitative courses like epidemiology and biostatistics. So we would want to make sure that you will be well prepared to take those classes. And we're also looking for basic understanding of science as you jump into the field of public health. There's an online application that you need to fill out. Unfortunately, UVM is not part of the SOFAs yet. So we ask you to submit a separate application with a personal statement, resume, transcripts, and 3 letters of recommendation. And we will review your application with unofficial transcripts as you try and get the official ones to graduate admissions office.
How long does it typically take when a student applies to find out if they've been accepted?
We review applications twice a week. So as soon as we have all the documentation, Dr. Carney will review the application and make the decision, and the student will be notified shortly after.
Right.
And we will also let you know, and we will also let you know if there is anything missing. So if we're missing a letter of recommendation from a certain person, we will be in touch with you and let you know so we can speed up the process.
Great. Yes. And what I was going to follow too is that there's various opportunities to apply. So you can see a couple of different application deadlines there, but maybe also just share some more information that are common questions that we get that might be on this slide, Vika.
Correct. So we accept students year round. You can start in the summer, fall, or spring. And if you would like to do a fast track, you can apply for the summer and do 15-month program. That would take you 4 semesters. The fall applications are currently open, and we will soon open our spring applications for 2023 as well. And as you can see, the deadlines for the regular M.P.H students and also the accelerated M.P.H, that is for UVM undergraduates only who will have to apply in their junior year. And as you can see, the tuition here, the Vermonters pay the regular UVM tuition per credit, but out-of-state students get the differentiated tuition. So you are paying a lot less than the regular undergraduate student, $970 per credit versus $1,700 like the undergraduate students do. And the federal financial loans are available to graduate students.
Great. And I will put a plug in again. If you have any additional questions, please do put them into the chat. We'll keep an eye on that. Jan, I wanted to come back to you for a moment, just thinking about the fact that this program, when you started it as an online program, as an online graduate degree program. You were ahead, I think, of many other programs, and given what we've been through in online learning in the last couple of years, why did you make that choice when you were launching the program here?
First, I am so glad we did this. And we did it because our students were asking for it. They wanted something that was both innovative but flexible. So many people don't just stop and do their degree. They're working either part-time or full-time. And we can, that can be something that you easily incorporate into your education. So you're still working and advancing yourself to what is, in my opinion, the most exciting field there is right now. So our faculty are prepared and work very hard to do asynchronous, meaning there's a schedule, but everyone doesn't have to be there at once. And they add innovative teaching and learning strategies into their courses, and our students give us high marks about the courses they've taken. So we hope that it's a great experience. I have to say that public health has never been more important, and we really need you to join our team.
Absolutely. And I see we do have a question. I'll get to that in just a moment. I wanted to follow up, Jan, too. The fact that we are CEPH accredited, and that's a fairly new in the last couple of years. What does that mean for a prospective student that the UVM's program is accredited?
When you finish the program and you might want to work at a very prestigious internship or organization. For example, some of the CDC programs, that accreditation, that national accreditation is very important. We're also, you saw the Association of Schools and Programs in Public Health. We're part of that organization, so that affords tremendous opportunities for us to get a national perspective and keep our education at cutting edge in public health. So I think both of those things, but our students get the highest quality education.
Absolutely. And I wanted to come back to the question here from Keelan. In the accelerated MPH program, would an undergrad student enroll in the program, pay both undergrad and MPH tuition, or only MPH tuition? And I might follow up as a UVM undergrad or an undergrad in another school. So would love that clarifying answer maybe back from Keelan. But Vika, do you want to maybe take this in terms of
Sure.
UVM undergrad? Thank you. That helps. There we go.
Thanks, Keelan. The undergraduate students will pay undergraduate tuition because your main designation remains undergraduate student as you start the program in your senior year. You will only be taking 2 or 3 public health courses. That is all that's allowed before you become a full MPH student that following summer or fall. And that's when your designation switches to graduate, and that's when your tuition will be MPH tuition and not undergrad.
Great, thank you, and great question, and thank you for that answer too.
And also, sorry, Nicole, to add to the financial aid, whatever you get, if you get financial aid, the package will cover your MPH courses while you're still a senior.
Important, super important. Thank you for thinking of that as well. Just wanted to plug for additional questions. We have just a few minutes here, and you're welcome, Keelan, of course. And while we're waiting to see if anyone has any additional questions, I'm going to ask Jan one more. You mentioned a couple different times the faculty experts that are experts in their fields. Can you just give us a few examples of some of the people that are teaching in the program, the kind of work that they're doing on their 9 to 5 and then teaching in addition?
Yeah, we have full-time faculty here who work exclusively at UVM, and they have a variety of expertise, and faculty are full-time faculty. And then for our part-time faculty, we have individuals who are experts in public health communication or public health practice. They might work at the Department of Health. It might be in environmental public health or global health. All different areas. We have one part-time faculty member who works in healthcare as a very senior person in healthcare and really understands healthcare systems and that relationship to public health from a real-world perspective. So our faculty experts who are working in all different other disciplines bring that real-world expertise to their courses and to our students.
Awesome. Thank you. I know how wonderful they are. I have the good fortune of working with them on many stories. Thank you, Vika, for answering the previous question. And then Deborah asks, regarding accreditation, is the program also part of the consortium of universities for global health? Jan?
I'm not aware of that at the current time. We have both the regional accreditation that is also common with all of UVM's graduate programs. And so we have the national accreditation through the Council on Education for Public Health, which is the gold standard for public health accreditation.
Yeah, great. Awesome. Hopefully that answers your question, Deborah, too. So if there's no additional questions, I think we'll wrap it up from here. But there's so much information on our website, which is uvm.edu/public health, or just search UVM Public Health and you'll find us. Lots of information about faculty. Oh, we do have one more question. Great, Catherine. Do merit scholarships awarded to undergrad students carry over to graduate studies for the regular MPH program? Vika, do you know the answer to that?
I'm sorry, I was looking.
That's okay.
Do merit online the merit scholarships? That would be a question for the Student Financial Services. I was trying to type it up. Unfortunately, I don't have the answer to that question.
Okay, great. But we have so many answers and connect you to people if you reach out to us on the website. There's chat. There's a live person. It might even be Vika on the other side answering those questions on chat as well. So please do reach out to us. We really do want to connect. And as Vika said earlier, she will absolutely set a meeting with prospective students to answer these questions or guide you on that path to get to the right person to answer questions as well. You're welcome, Brittany and Catherine and everybody. Hopefully we've been able to answer your questions today. Thank you, Jan. Thank you, Vika, as always, for joining us and sharing about this incredible program. We hope to see all of you in a future career in public health. We wish you a great afternoon. Take care.